First of all, let's clear up any confusion there is about COVID vaccination in transplant recipients. And I think that there's a general consensus that, first of all, transplant patients should be vaccinated. Our preference is either the Pfizer or the Moderna vaccine. I think that's where the most data really comes from. And so I think most of us would stick to that. We also know that the responsiveness of transplant recipients is somewhat less than the general population. So they maybe 50% or even fewer will have significant antibodies to the virus after vaccination. And so it's become a common practice to vaccinate these individuals a third time. The third vaccination coming sometime, a month or 6 weeks after the second vaccination. And it seems that in doing that, generally you get a boost in antibody development. And so it has become now a common practice to provide our transplant recipients with multiple vaccinations, 3. And then what happens beyond this, not clear. We're just too early into it. It's not clear where we're going to go in terms of revaccination, boosters, et cetera. But I think the data are pretty clear in terms of the need for a third vaccination. I won't comment on vaccinations in general. I think so much has been said about that. Strong advocate for vaccinations, and anybody in whom it's approved that is 12 years old or above, there are very few reasons not to get a vaccination. And it makes me sad to see all the controversy about the vaccinations and all the potential evil and harm that comes from it. It's all, just bogus as far as I'm concerned. And then regarding the complications the fungal complications in transplant patients, they are a bit different perhaps than what we're seeing in our general population or non-transplant population. I think that it's, this gentleman had Cryptococcosis. We've seen 6 total so far, and 5 of them have had transplants. The other individual was receiving a monoclonal antibody. So it seems that it is occurring in, at least in our experience, in previously immunocompromised individuals. And so to say that crypto should be a concern across the board for COVID is probably an overstatement. However, if you're dealing with a solid organ transplant, it probably should be a concern, something to be just looked for. In this individual, it occurred almost simultaneous with the COVID. I mean, it was a few days or a week or so after onset of symptoms, but I think that he is a good illustration of the type of patient we're seeing with this. The other 2 things that I think we should be cognizant of that are, I think, common to all COVID patients, or all COVID patients seem to be at risk, at least those with severe disease, those who are intubated. 2 things. Number 1, Kappa, or COVID-associated pulmonary aspergillosis, seems to occur primarily in individuals who have been intubated. So respiratory failure, on the ventilator for 72 hours or more, usually receiving steroids, and really severe disease. And then the development that can occur anytime after intubation and severe respiratory failure. But I think you're looking for it generally within 10 to 12 days. The other thing that everyone seems to recognize, but we don't document or talk about a lot, is candidemia. And I think our rates of candidemia in our COVID patients, particularly those in the ICU, are just remarkably high. I was seeing some data from one of our colleagues where their rates of candidemia in their patients, in their ICU patients, had gone from 1 in 1,000 ICU patients in their pre-COVID era to now 7 in 1,000 in the post-COVID era. So I think all of us have seen candidemia increase in this population.